But if you have secondary dystonia, and especially if it's in the midline, like the neck and the back, you have a lot of pulling, there's a chance you might have a harder time getting good improvement with your DBS. So if you have dystonia, and that's the reason you're going for DBS surgery, you really want to know and have that discussion. What type do I have, and what do you think the outcome is going to be? Understand that, and that's a conversation to have with your neurologist or surgeon. The same thing with tremor. Not all tremor is alike. There are hundreds of causes of tremor. The majority of people have essential tremor. That's like familial tremor, Katharine Hepburn tremor. But you can also have secondary tremor, and we all know about the tremor in Parkinson's. DBS can be a very effective treatment for tremor, especially the Parkinson's tremor, and especially essential tremor. If you have tremor from another cause, sometimes it's a little bit harder for the DBS to treat. An example of a tremor from another cause, again, if you had a stroke or an injury to a certain area of the brain, it's harder to treat. Also, if you have essential tremor, some parts of the tremor are easier to treat than others. So in essential tremor, people have tremor in the arms, they can have tremor in the voice, and tremor in the head, back and forth, up and down. Tremor out here in the arms tends to respond very well. When you have tremor closer to the shoulder respond, sometimes it can be a little trickier. And that's an important thing to know, because if you have essential tremor, which means tremor that comes out with activity, what do you need to do, and what makes the tremor? So many of our tasks require us to bring our hands up to our body, right, and our face. Midline tremor is a little bit harder to treat. So a little closer to the shoulder, a little harder to treat. And also the head and the voice tremor, a little bit harder to treat. So again, important to understand what are the expectations for DBS improvement. Easier to treat out in the hands, gets a little bit harder as you move in towards the head. Now I want to mention a few things about general health and wellness, because your Parkinson's can change. Parkinson's being a progressive condition. Maybe if you had essential tremor, that doesn't change so much over time. Maybe if you're fortunate, dystonia doesn't change over time. But if you have Parkinson's, it does change over time. And on top of that, we're getting older, right? I remember seeing a gentleman, he was in his early to mid-90s, and he had Parkinson's disease, doing exceptionally well. And he says, "Doctor, my balance is awful." And he gets out of the chair and he shows me his balance, and he's walking past all the 40-year-olds in the clinic, and he came back down, and he just was a tremendously active man. And he wanted a change in his Parkinson's medicines, and it wasn't his Parkinson's. He'd had some minimal, mild balance changes, which were in part related to another condition of aging. So remember, we still have to take care of ourselves and our bodies with DBS. Now, some of you who have had deep brain stimulation in the subthalamic nucleus, that's the target area for Parkinson's, have probably had some weight gain. That can be an issue. And with weight gain comes problems with stamina, maybe cardiovascular concerns, back pain. So we really do have to pay attention to diet after DBS. We don't know why this weight gain occurs. There's many hypotheses. One is you don't have tremor and dyskinesia anymore, and you're not expending all these calories moving around. There are hypotheses that the weight gain might be related to metabolic changes due to the stimulation. We just don't know. There's also people, we've had, craving sweets. If you have Parkinson's, you probably are nodding your head, craving sweets. Yes, that's me. I have a sweet tooth. And we literally had a patient say it's just a heck of a lot easier to get up and go to the fridge. So the work of eating was a lot less, and so they're able to get out more and do more, and more opportunities to eat. So you do need to pay attention to your diet and your weight gain. Now, this is especially so for tremor, dystonia, and Parkinson's. If there's an acute change in your symptoms, is it your disease? Take a guess. If something happens quickly, it's probably not your disease, right? Just think if you have Parkinson's. It's a relatively slowly progressive condition. It happens over years, not days. If there's a change, there is something else going on. So if you have DBS, it just increases the number of factors of things we have to look at. So we'll look at right away, did somebody change your stimulation? Is the system working? Is there a breakage in the system? Did it turn on and off? But then we're also going to look at other stressors, because anything that stresses you can make tremor worse, can make Parkinson's worse, can make dystonia worse. And that stress can be anything. It can be emotional stress, a death in the family. Financial stress is a big concern these days. Or a medical stress. And the most common medical stresses we look for are dehydration, infection like bladder infection, aspiration pneumonia this time of year, flu-like symptoms, so you feel like you have a virus, or even cardiac problems, cardiac ischemia. We have had patients that have had subtle symptoms, subtle chest pains, thought it was the rigidity, the tightness was the Parkinson's, and that caused all the Parkinson's to get worse, but it really was the symptoms of the heart attack going on over many days. So, quick change in your symptoms, we need to see what is causing it. It's not just the primary disease, it's how the stresses affect the primary disease, or now we have the piece that we have to evaluate is the DBS. Here's another thing that happens, especially for the Parkinson's patients. They have a change in activity level. Is your body up to it? So think about this. If you had Parkinson's for many years and you didn't do very much, and now you feel better, is your body ready to go from 5 minutes of activity to 2 hours of activity? Probably not. So we're dealing with the Parkinson's symptoms, are they ready? We're dealing with the physical body, is it ready? And if there are arthritic conditions, you have back pain, you have knee pain, you're putting more stress on that. So it's not uncommon that we'll see people whom, after surgery, now they say, now my knee hurts. And it could be a couple of things. One thing is increased activity. Yes, your knee hurts because you don't have the strength, you don't have the stamina. You really have to do rehab to get the body back into shape to do what you need to do. The other interesting thing that happens is if you take away one symptom, you notice another symptom. It's human nature. All of us are susceptible to this. So if you have less to worry over here, then you're going to focus over here. So you're going to notice things, you're going to attend to things, and you're going to prioritize things differently after surgery, right? So you might say, I never had a knee problem before, and we might look back, well, it looks like you did have a knee problem before, it just wasn't the primary thing you were worried about or concerned about. But now, because everything else is better or you're moving more, it is something we need to be concerned about. So one of the tips we learned over time by taking care of people is with DBS is if there's a serious problem, we might say, a patient might say, yes, I have a serious problem with my knee and I'm going to get my DBS first and then go to the surgeon and get my knee done. So we suggest, why don't you see the surgeon, have an MRI of your knee, and then you'll have that MRI and that information if he needs it later. Because once you have the DBS, you can't have an MRI of your knee. So it might be helpful to do some pre-preparation.
What do they do in place of that?
Well, there are other imaging techniques they can use, and CAT scans, for instance, can be done. But I can't answer you the specifics on how the it doesn't mean you can't have your knee taken care of. It doesn't mean that the orthopedist does not have other techniques. But an MRI is a imaging tool that they like. They like to see those MRI pictures of the knee. If this is part of your future, it might be something that you would prepare for before DBS. And is I see her in the audience. Is anyone going to talk a little bit more about MRI? Or is tech support going to do that? Okay, because I don't have a lot of time to. So you'll get a little bit more information about the issues related to MRI and your DBS implant. The other is low blood pressure sometimes is a symptom of Parkinson's. Sometimes we make it worse with our medicines. And if you have low blood pressure and you have dizziness and now you're more active with your DBS, it might be a greater fall risk because you're getting up more, your blood pressure is low. These are just things where we learn that just because you're doing better does not always mean you're doing better. So we have to basically try to prepare for all these things. And remember, the balance, the posture, the speech, the swallowing issues, especially with the Parkinson's, can be long-term problems. So it's very important to pay attention to them, and if you're having a balance problem, work with the therapist. Do your balance exercises every day. I tell my patients, some days better than others, I do balance exercises every day because I want my balance to be way up here if there's a change for me down the road. And that's what I want you all to do. So for Parkinson's, you want to focus on your balance and your posture. You want to know with the motor initiation and freezing problems that don't respond to DBS or medicines, how do I get around it? How do I deal with it? How do I manage life with it? Tremor, patients with essential tremor, surprisingly, have some balance issues. So we think of essential tremor only as a tremor problem, but there are some balance issues if you have essential tremor. So important to see the physical therapist, get some balance exercises and do them. And then dystonia, especially if you have dystonia of the trunk and the neck. It's really hard to have very good balance if you are not perfectly aligned, especially if over time you lose some balance. There's another reason why we focus on balance, balance, balance. You have those little wires in your head. We don't want you to fall at all, but we certainly don't want you to fall and hit your head and damage those little wires. So very important to focus on balance. And then for better or worse, we're all getting older, right? And so we're getting older on top of our symptoms. So balance might be a little bit affected, arthritis might creep in there, fatigue and stamina, maybe our heart's not as good as it used to be, maybe we have diabetes and it's affected the nerves at our feet. All can affect how we walk and balance. And the other thing is with the DBS programming, and when the programmer changes the stimulation, that might even affect balance. So if the programming is not appropriate and we stimulate the wrong areas, especially one particular area of the brain called the thalamus that is used for tremor, we can actually cause some balance problems. Well, that's what I meant by stimulation is good, but more is not always better. It needs to be the appropriate stimulation for the brain area. Posture, posture, posture. We need to work on our posture. That's also part of balance. It also helps to reduce the pain and the musculoskeletal problems. And posture also affects speech. So those of you that have speech problems, if you have it from your dystonia, if you have it from your tremor, if you have it from your Parkinson's, it's really hard to be effective with speech down here, right? And not only that, speech is a tool of communication. So it's really hard to communicate with the world when you can't see. And so what happens? Unfortunately, to many of our patients, they just stop talking. They just stop communicating and can withdraw. We don't want to see that. So a few more things about speech. There have been some reports that there are some speech patterns and really cognitive issues that can change after DBS. Typically, it's quite subtle and not even noticed so much by the person. We could pick it up if we do some formal testing, and that's called verbal fluency. And verbal fluency problems are really problems that many people with Parkinson's disease have anyway. Can't get the right words out. I know what I want to say. What's that word? Just have a hard time getting tip of the tongue kind of phenomena. Sometimes we do see some changes there.